So Ronnie sprained his ankle a couple days ago. He's currently in the acute stage of the healing process. So we're going to apply some ultrasound to his lateral ankle today and hopefully take away some of the pain that he's experiencing. Some contraindications for ultrasound therapy include if the patient has active cancer or a pacemaker device, or if we're doing the ultrasound over any reproductive organ areas, or if the patient has impaired circulation, or if the patient is still growing and we'd be going over those growth plates in those bones. Some indications for ultrasound include soft tissue healing and repair, remodeling scar tissues, muscle contractures, chronic inflammation, and bone healing, to name a few. So we're going to go set up the machine to get ready for Ronnie. So, since Ronnie is in the acute phase of healing, we don't want to apply any heat or thermal properties into the injury site. So we're going to go ahead and just hit this sound button. And since we're on the lateral malleolus, it's kind of a shallow area. So we're going to set the machine to 3 megahertz. And again, so we're going to set that duty cycle to 20%, and that's going to make it so this is a non-heating ultrasound. Um, and we're also going to set the intensity between zero point 0.5 and 1. So we're going to go kind of that zero point 0.7 area. And again, this is going to make it so it's not heating up that tissue because we don't want that. Um, and time, we're going to go somewhere between 5 and 10 minutes. I'm just going to go 8 minutes with Ronnie. And looks like we're all good and set up on the machine. So now we're going to talk to Ronnie. Hey, how are you? My name's Blaine.
Nice to meet you, Blaine.
Cool. So I understand you had a little accident in your yard the other day with the gopher hole.
Yeah,
Yeah. Kind of tripped, kind of twisted your ankle a little bit. Yeah. How you feeling right now?
kind of hurts.
Kind of hurts. Okay.
So it kind of hurts to move around.
Yeah. Do you have like an open wound on the ankle, or is the
No,
skin okay?
it's okay. Yeah,
Skin's okay.
it
Okay.
hurts me.
All right. So how much pain are you in right now?
A little, but not a lot.
A little bit, not a lot. Okay. Well, we do something at the clinic called ultrasound therapy. And that kind of helps us get into that tissue and take away some pain that you might be feeling. Have you ever heard of ultrasound before?
Only for like babies.
Okay, yeah. So this is kind of the same thing. We use a machine and we send sound waves into the tissue, and it's not something that should hurt, but it's something that should help um, that scar tissue, those different tissues to kind of heal and take away some of that pain. Does that sound like something you'd be interested in doing? Okay. So I'm gonna have to like put my hands and like this ultrasound machine one like on your ankle. Are you comfortable with that? Okay, great. I'm just gonna go ahead and look at that ankle real quick. Just make sure there's no wounds going on. Okay, Ronnie, I also understand that you have type 2 diabetes, is that correct?
Yeah.
Okay. So do you have any type of like impaired sensation down here on the foot?
No.
Can you feel my hand right now
Yeah.
on the foot? Okay, good, because that's important because this machine may be heating up that ankle, and so I need you to be able to tell me whether or not it's like burning so we can change things. Okay?
Okay.
Great. Okay. Can you tell me where your pain is on your ankle?
It's like on the outside.
Outside, like right here?
Yeah.
Is there any on top?
A little.
A little bit. Okay, great. So this treatment that we're going to do, it's going to be about 8 minutes.
Okay.
Are you comfortable in this position that you're in right now? You are?
Yeah.
Okay. If you get uncomfortable, tell me.
Okay.
We can stop, we can move around, we can change, okay?
Okay.
Awesome. So I'm gonna put this towel, I'm gonna put one under your foot here.
Okay.
Great. Just because when we use this machine, we use gel to help it go. So it's gonna be kind of cold, and it might be running off onto the table. That's why we have this towel here. And I just put it on this counter right here. Let me grab it. Great. Again, it's going to be cold. Sorry about that. We're just going to go ahead and put this gel onto the ankle here. And actually, can I have you extend this leg out? Okay. Are you okay there? Are you comfortable? Okay. So we're going to turn this leg just a little bit. We're going to apply that gel there. And then, again, this is what the ultrasound head looks like. So we're just going to put this on here. The machine's not on yet. Don't feel anything. Okay. Now we're going to go ahead and turn this machine on. Um, Again, so what we're doing is we're sending sound waves down into that ankle. Um, you shouldn't feel much with the settings that I have on. Um, Something that you could feel is it might start to get a little warm, um, maybe like a burning sensation. If that happens, tell me, because that means I need to change something on my end in the machine so that you don't feel that, because that's you don't want that, okay? So you got to pay attention to what you're feeling. How are you feeling? Is this hurting anything? No?
I feel like you
Great. Okay, we're gonna pretend the 8 minutes is up. Okay, so we're gonna go ahead and keep that head on there. Turn the machine up. Lift it up. Wipe this head off. Lift it back on. The ankle off. Okay, your skin still looks okay. How you feeling, Ronnie? Good. You ready to move on to our next activity? Great. Let's do it.